want to ask the Assemblyman a quick question. Speaking of sleeping in your office, you're probably going to start doing that soon since the budget is still on the table. Speaking of the budget, do we have any inkling if we're getting any money for the new hospital? Any talk about that?
Well, we're still talking. One of the deadlines that came up was this past Friday. The governor has something called 30-day amendments where he can amend his budget up to 30 days after he puts it out there. And there was some talk about possibly putting the hospital money back into the 30-day amendments. That did not happen. The governor did not do that. I wasn't expecting him to do that. I think this is going to get driven forward a little bit more into the budget negotiations. Hopefully by April 1st there'll be some more clarification on that. But he did not put it in his 30-day amendments, which is, I know, what some people were hoping for. But look, I had a conversation again this past Thursday with his director of operations, who's really one of the top officials in his office, right below the governor. And he again said, "Look, we know that we made a mistake here, and the governor is still committed to doing this. So I think we're going to see this get done." And the hospital has been very good since the budget came out. Meeting with Department of Health officials. The commissioner of the Department of Health is actually coming to Utica in a couple of weeks to sit down with the hospital to talk about the plan. So really it's about the hospital putting a plan together for this new hospital, and the state will work with them to help to fund it. So it's just a process.
So they're waiting to see from the hospital an actual plan. Is that what you're getting from
Right.
Albany?
Well, what they've looked for, what they asked for is a timeline, and the hospital did provide them with some timeline as to where they want to go with the whole thing, and also showed them over the last year what they have done for this. The hospital spent about $500,000 already of their own money on engineers and architects and planners to try and help work through the process of picking the best site for them. And developing some plans for the new hospital.
So that's a study? Is that a study that they need done?
Those are consultants that they've hired, but there's more that has to go forward in terms of the downtown site and others. But right now, the point that we've made to the governor is that $300 million was the base that they could start planning on and building the new hospital, and then they can go out and bond for the rest of it or raise the money through charitable, do it through charitable donations and things like that. So the governor's office is now very engaged. They are working with them. The Department of Health is working with them on the plan, and they've committed again to us that the governor's committed to doing this. He made the promise last year. He's going to follow through on the promise.
And what do you think happened? What caused it not to be in the budget?
It's so hard to say. I think there's some talk about maybe changeover in staff and things like that. The staff has changed since last year, so there were some immediate capital needs at other hospitals around the state. Mohawk Valley Health System is not ready to spend $300 million right now. So what the state has been talking about really is doing some kind of a multi-year commitment for the hospital. So much this year. It's a 5-year process from start to finish for building a new hospital. So it's going to be something that can be phased in possibly over the next 4 or 5 years, as opposed to getting $300 million up front and then not spending it right away, waiting until 4 or 5 years down the road.
Do you think that the fact that the area seems to be in disagreement as to the location of the new hospital played a role in that, or did?
Well, I think that certainly some of the negativity doesn't help the situation. I think that I think there's a very vocal group out there who is against the downtown site without even seeing a plan, and that's what's unfortunate about the whole thing is that look at the plan first before you come out and criticize something. You don't even know what the plan is. Let the hospital put the plan out there, and then we can have discussions, public discussions about that. But to say you're against something without even seeing it, how can that seems disingenuous to me. Let's look at the plan first, and then go to other cities where there are downtown hospitals and see some of the vibrancy in the businesses and people walking around those areas. Just because there's a hospital there doesn't mean you can't have a walkable neighborhood or shops or restaurants and other things. Hospitals, if you look at studies done by Brookings Institute or other organizations, hospitals and universities in your downtowns are considered anchor institutions, and then you build around those the hospitals, the hotels, the apartments. Having 4,000 people in your downtown working is going to have some effect to the surrounding businesses. Look at Buffalo and what they're doing with their downtowns now. Look at Syracuse. Look at Cleveland. Look at some other cities where where hospitals are located. And the arguments about parking and traffic and everything else. No one's going to put a hospital down there without doing those kinds of studies to make sure it works. The parking, the traffic, everything else. It's just not going to be, oh, here's a new hospital. We're taking out all these buildings, and we'll figure out parking and everything else later on.
So speaking of a plan, I know when we were talking a couple weeks ago, it sounded like the public would see a said plan from MVHS probably around April. Is that still kind of the timeline, or are you trying to push for that earlier so that Albany will actually put the money into the budget partial.
And going one further, Anthony, if they do, and when they do come out with a plan, will it be a multiple plans? We'll say, okay, here's our take on what downtown would look like, and if that is not conducive, and if that doesn't work, here is another opportunity or another site for this plan.
Well, what the state is interested in seeing really is a timeline. There's not going. I don't think there's going to be a plan by April 1st saying this is the architectural design of the hospital.
Right.
This is what it's going to look like. I don't think that's going to happen by April 1st. Not having the money right there, right now to move forward is kind of put the brakes on everything.
Mm-hmm.
So what the state is really looking for is the timeline from the hospital. Year one, 2016. What are you going to accomplish in 2016, 2017, 2018, 2019? And then the state can go forward and say, okay, we need to allocate this much money year one, this much money year two, this much money year three. That's really what the state is looking for in terms of a plan right now. But also, how are you going to finance the rest of the project? Okay, if we give you $300 million or something more than that, where's the rest going to come from? Because it's going to be a $500 million, $550, $575, whatever the number is, to build the whole entire facility. So where do you come up with the rest of the money?
One of the questions
that's what the hospital is working through with the state right now.
One of the questions we did have, and I'm not sure if you can answer that before we take a break, but would the county be involved in ponying up some monies or monetary wise? Would they bond out for it? Would they be involved, do you think?
I think County Executive Pacenti has been very involved in the discussions, and I don't want to speak for the county in terms of spending their money.
Sure.
But I'll be happy to. The county's been very engaged and certainly has been in the discussions about putting some skin in the game,
mm-hmm.
whether it's for site work or parking garages or things like that.
Okay.
There will be some I think work on the part of the county, the city, others who can help with those kinds of things that go along with building the new facility.
Perfect. Good discussion, and we'll definitely be watching that. Kudos to you for keeping your eye on that and pushing forward. You just mentioned last Thursday you had another conversation, so you're not letting it go by the wayside. So